the tubes, the ovaries get swollen. Still now, menstrual problem is an issue. First of all, they have a fear to talk on the menstrual topic with their own parents. Infertility, they do not get conceived. Sometimes there are certain problems of menstrual disorders like PCOD. Bacterial growth do not occur too much, but in the tampons, the bacterial growth occurs.
I want to thank you for taking time out and joining me at Subhag TTC for this very important talk on menstrual health and period poverty.
First of all, thank you so much for inviting me for this interview.
Sure.
And it's always my pleasure to give a awareness talk on any of the topic related to any gynec disorder. And I feel really very nice because maybe this video clip or this interview will help many of the women who are facing this problem.
That's true. Before proceeding forward, I want to ask you to help me define what menstruation is, how and when it starts.
So, first of all, we'll start. What is menstruation? You ask me. Menstruation is also known as period, or in Hindi, we call it as a Masik Dharma or Masik. It is the monthly vaginal bleeding that occurs when the lining of the uterus is shedded. It is the hormonal cycle which is regulated by certain kind of hormones, and this total cycle is regulated by the hormones. So, what the menstruation indicates that the female is able to now conceive, and usually it starts at the age of around 12 to 14 years. If you see the monthly cycle of the menstruation, it usually occurs on every 28 days. So people have a myth that I'm getting a menstruation 2 days, 3 days before. So it's okay, you should not be worried. This is a healthy. So we usually say 25 to 28 days cycle is the normal cycle. But in many of the patients, it's like we seeing that many of the females have a problem like they have on 21 days and somebody have an issue like 45 days. So if it is coming on every 45 days also, but regularly without any associated symptoms and sign of menstrual irregularity or menstrual disorder, then definitely it is a healthy menses. So overall, if we'll see that we can keep in a category as like 21 to 45 days cycle. It varies among many of the patients. But if you'll ask me, normally it is 28 days cycle. Last menstrual period was on 8th, for example, 8th of September. So this month they'll get 2 or 3 days prior, around 5. So this is a normal. Some females think that the same date will goes on lifelong. It's not like that.
That's very important to know. Do you know why there is a difference in timing? You mentioned 21 days, you mentioned 45 days also. Why is there a difference?
There is a difference in timing because it's all dependent on the hormones. Okay. There are certain hormones like estrogen, progesterone. Okay, these all hormones are responsible for menses. So what happened? The female having a ovulation. Ovulation is a physiological process in which the ovaries of the uterus releases an egg for pregnancy. Every month, the uterus is preparing for pregnancy. So if the ovulation occurs late, in such patient the menses will happen very late. And if any of the women having a ovulation early, that like see we calculate the ovulation time between 12 to 18 days. If the ovulation occurs on 18th or 20th day, definitely her menses will come on 35-40 days. And if any of the female having a ovulation early, like on the 10th or 12th day, so they will have a menstruation early. And if any patient having a ovulation on 14-16 days, so they will be having a menstruation on 28 days cycle.
Okay. Well, here I was thinking that the length of the menstruation was the main indicator of the ovulation period of a woman, but it's the other way around. Thank you for clarifying that. Dr. Khushbu, can you explain the importance of menstrual health in relation to women's overall well-being and also reproductive health?
If we talk about the reproductive health, the very most importance of menstruation is that the menstruation indicates that female is going to like she is now capable to bear a child. So it's the very most importance of menstruation health is about the reproduction. If the menstruation are not proper, definitely the female will be having problem in getting pregnant. See, if the menstruation comes normally on 28 days, or as I said, between 21 to 45 days, if it is a regular, and if ovulation occurs, then definitely the female will be getting pregnant. And if the menstruation are irregular, whether it is excess or scanty, any of the issue will be there in the menses, definitely the female will be having a menstrual issue. Then they will be having certain diseases such as PCOD, endometriosis, endometrioma, ovarian cyst. These all problem indicate land her to the infertile stage. So reproduction is a very important criteria of menstrual regularity. And if you'll ask me about the overall health means like menstruation. If the female will be using unsterile or clothes and napkins, such kind of things will be done. So definitely they'll be land in a serious infections also. So menstruation is also related with the infection. If a female having a unhygiene menstrual care, then definitely they'll be having a certain kind of infection. So definitely they'll be using clothes, and some of the patient have a habit to reuse the sanitary napkins also, or clothes also. They'll wash the cloth and again use. So this all land her to the infection. And always menstruation cycle is related with the psychological well-being also. If any of the female, you just pick up any of the female, if her menstruation is proper and normal, definitely her psychological well-being is also normal. If a patient having an irregular menses, they'll be always having a fear of not getting pregnant, fear of getting pregnant also. She will be always anxious, like, oh, if they had any unprotected intercourses, then they'll be always anxious about the menses, like when my menses will come, last was the visit, still I didn't get. So her menstruation always directly proportional to her physiological well-being. So these are the relation with the menstruation and her overall health.
I wonder, since menstruation is so important and every woman must go through it, what are the grassroots initiatives that people and government are taking? Do you have any idea of educating the masses? Because here, today we are talking about women using clothes, washing them and reusing. Are we spreading awareness?
No, nowadays I don't think so. So much of awareness are being given to the rural areas. Okay, in the cities and all, they have an advertisement. They'll be having a campaigns and some workshops or some educational programs on menstruation. Certain schools are there. They used to do, but in the rural areas, still now, menstrual problem is an issue. First of all, they have a fear to talk on the menstrual topic with their own parents. They hide. A very simple thing is the cramp pain in menses. This is a very simple thing. We call it as a PMS, premenstrual syndrome. Many of the girls having this problem of PMS, but they shy to share with their own parents. They have their mindset that this PMS is normal, and some of the female have a heavy menses. We call it as a menorrhagia, but they do not share it with anyone. They feel shy to share because of lack of awareness and education only. So somehow they come to the clinic, somehow they share with their mother. If the mother is not educated in this menstrual topic in a rural area, what initiative we should take is like, we should, in a small villages, we should give a awareness camp. We can distribute the sanitary napkins, and we can teach them, we can explain them that using cloth is so much toxic and so much infectious to your, at least a very, it's genital, it's a very delicate organ. So you should be aware. We must do these things in our rural areas, either in a small schools in rural areas. We can educate the girls over there. So these all awareness are still lacking in the rural areas. Having an irregular period, many of the girls came to our OPD giving a symptom like, I got a menses once, and then after 1 year I did not get any menses. And many of the girls are telling that we got a menses on every 3 to 4 months. So this is also not good. This will land her to the PCOD, ovarian cysts. There are certain diseases. If you will treat them before, then only we can able to cope up with that. So there are many things like still we have to do in the rural areas.
Coming to rural areas, period poverty is a reality. Period poverty where many people do not have access to basic sanitary napkin and such. How would you define period poverty from a doctor's perspective? And what are some of the most direct consequences period poverty has on women and girls?
First of all, I will explain this term. What is menstrual poverty?
Yeah.
Poverty related to the menstrual issues. Menstrual poverty is the lack of access to menstrual products, sanitary napkins, sanitizations, and disorder on menstrual health. If we'll explain it in a clear terms, it's like because of lack of education, because of lack of awareness, they are using, unsterile napkins or reusing the clothes again and again, and they will be like they don't know how to dispose the sanitary pads or clothes. They just throw away in an open area. And if they have any menstrual issues, as I said, irregular menses, heavy bleeding, painful menses, they will not share with anyone. They will just skip in them because they don't have money. So what we can do is that we should first educate the girls, the school going girls. Many of the school going girls have a fear to go to the school because they are not using the sanitary pads. They are using clothes. And the clothes when get wet, it will just put the stain marks on the clothes. Whatever they'll wear in a school, they just run away from the school. For 5 to 6 days, they avoid going to school because of the money issues. And nowadays you see there are so many fancy sanitary napkins available in the market, and it is affordable for the soundful people, for the middle class people, but for the poverty people, they do not afford it. The women run away from their work, and because of hiding their menstrual problem, irregular menses and all, they land in the infertility also.
Yeah, so you said because of lack of awareness on basic menstruation poverty and lack of access, women land in infertility. How is that possible? Can you explain to us?
Say if they're having a irregular menses, then definitely ovulation doesn't occur, and because of that they land in the infertility. They do not get conceived. Sometimes there are certain problems of menstrual disorders like PCOD. Like this, it's a disorder. Someday we'll discuss on PCOD. PCOD is a medical condition dealing with the menstrual problem. What happens if any female having irregular menses, they're having a PCOD. PCOD is like the ovaries of the uterus. In that, a small cyst will be formed, which is like a garland, like a pearl garland. It's totally at the periphery of the ovaries, and because of that, the hormonal issue occurs, and because of that, ovulation do not occur. No ovulation means no pregnancy, definitely. Ovulation means the release of egg from the ovaries, which is responsible for conceiving. Pelvic inflammatory diseases, PID, so cervicitis in the next stage is PID. So in PID also they do not get conceived. Sometimes if the PID is very chronic for long time, so there are many, if they'll be using unsterile napkins and clothes and all such things, what happens? They'll be getting first the infection occurs in the vagina, and then it cervix, and then it's travel up to the uterus, and then when it's travel to the uterus, it creates a PID, and if there'll be PID, then there'll be a not able to conceive. The tubes of the ovaries get swollen, so because of that they do not get conceived.
Everything is so related and so tightly knitted together that it's very scary. Dr. Kushba, I want to talk to you about sanitary napkins. When we talk about sanitary napkins, we have got different brands which sell the sanitary napkin that we all know. Then the lesser known product is the tampons that you see in pharmacies. Then we have menstruation cups. Then women use, like you mentioned, clothes. What are the pros and cons of all these products?
Okay, first I'll talk on sanitary napkins pros. It is easily available. Nowadays, the size is very compact. You can carry it in your purse also. The pros, we can say it's not too expensive for the middle class. For the poverty, definitely it is expensive. Nowadays, there are so many sanitary napkins which can cope up with the, false smell of menstrual blood. There is a floral smell will come from that. If any female use it, they feel very good, like the smell is stinky smell will not come. We can we can measure the amount of blood loss. Like measurements, like we usually ask in the history to the patient, like how many pads do you use in a day? So it will give us idea that how's the bleeding is, it's heavy or less. So it just give an idea about the menstrual blood. We discard it very nicely. Nowadays there are so many sanitary napkins comes with the disposal plastic bag. You need not to wrap in a newspaper and all. There are sanitary bags also they give us to dispose. So these are the pros. And cons is like the very first thing, for the poverty people, it is costly. That's why they are using clothes. The second is, nowadays there are so many brands available. People usually confuse what to take and what to not, and they do not take according to that blood. Like some of the females have a heavy flow, so they have to choose the sanitary napkins according to that. And also we see the size issue also. Like some, they don't have idea that sanitary napkins come in a size also, LXL, double XL, triple XL, such kind. So they don't have an idea about. So they have to take that in mind, that they have to select according to the size and according to their bleeding pattern. So these are the cons. And if we talk about the menstrual cup, so menstrual cup is like, what is menstrual cup actually? It's a cup shaped device which is fitted inside the vagina. And what happened? The blood, menstrual blood, is collected in that cup, and the female have to discard the menstrual blood and then wash it, and then again they have to fit it. The pros in menstrual cup is that they can use again and again. Like they can use it for this period, then again they can use for the next. If they'll sterile it, they comes in a silicone or rubber material. So they, what they have to do, they sterile it and they use it again. So it's little bit less expensive. We can say that they don't have to buy again and again all the month. They have to buy the pads. This is the only pros. The demerit of menstrual cup is they have to fit, which make them uncomfortable. And sometimes what happen, like they have to wash again and again. They have to remove it, empty the blood, menstrual blood, and wash it, and then again fit it. So this make it little bit uncomfortable to the female. And definitely menstrual cup can be used by the females, those who are married. Unmarried women, virgin girls cannot use this one. And these are the demerits of menstrual cup. And if we'll talk about the tampon, a very interesting thing I'll tell you about the tampon. You know what is tampon actually? It's a kind of cotton bud kind of there. You have to fit it in the vagina inside, and what happened, it absorb all the blood, and then there is a thread hanging down from the vagina, and after few hours, if you feel that it's gotten full, you have to remove it. You don't have to use it again, as like I said, menstrual cup. You have to discard that, and it's a very small size. You have to put inside the vagina. I don't think so. Tampon is good. Being a doctor, I do not suggest. The pros of tampon is that the female, those who are having a very heavy menstrual flow, they can get benefited that they have to fit it, and for few hours, 8 hours, 10 hours, 12 hours, the blood will be get absorbed, and then at after 12 to 14 hours, they discard it according to their menstrual flow. Somebody discard in a whole day, just skip it, and then at night before going to sleep, they just discard it. But I said, it's all depend on the flow of menses. Female having a heavy flow, they have to discard on 6 to 8 hours. Those who are having a less flow, they discard it on 12 to 14, 16 hours. The very demerit of tampon, which I am going to tell you, is the risk of getting toxic shock syndrome. Now you'll ask me, what is this toxic shock syndrome? Bacteria enters the body and it releases some harmful toxins inside the vagina. By the media of the stampules, the bacteria enters the vagina and it releases the very harmful toxins associated with it. Tampon usage can change the inner vaginal environment also and make it more susceptible towards the bacterial growth or bacterial infection. So this is a toxic shock syndrome, and I've seen the patient using the tampon developing the toxic shock syndrome. So I do not recommend it much. Tampons are not actually good because see, in a menstrual cup, you just remove the blood. Bacterial growth do not occur too much, but in the tampons, the bacterial growth occurs. It changes the pH of vagina. If the vagina pH changes, then it is more prone towards the bacterial growth and all. So that is why the bacterial growth occurs more, and it creates then again the cervicitis, vaginitis, pelvic inflammatory disease, and so many problems. So I do not suggest the tampon. And if it come on the cloth, definitely cloth is not a good choice. And as you know, the pros is only this, that for the poverty people, it is like easily available. They just the old clothes, whatever they have available, they do not care for the material also. They just use it. So this is not a good practice because cloth is always creating a fungal infection. Always. That is not good. Cloth is always have a demerit only. The merit side is not good of that.
Yesterday, the woman who helps out at my house came, and she said that when she gets her period, she doesn't use anything. She just lets the blood flow and the clothes get spoiled. So that is the reality of a lot of people. I want to come to disposal of sanitary napkins, which I see is an issue across India. Whether it goes in landfill, whether it is thrown anywhere, it's not biodegradable. Most of the sanitary napkins available in the market. What can be done about this, and what are the other alternatives to using non-biodegradable sanitary napkins?
In the non-biodegradable sanitary napkins, among all the list which you said me, like clothes, sanitary napkins, tampons, menstrual cup only fit in that criteria. Like there is you just have to flush the menstrual blood, that's it, and you have to reuse the cup. But there are certain ways how to dispose the menstrual napkins, tampons, and clothes. What you have to do is that wrap it in a newspaper or a toilet tissue roll, or any kind of paper sheet, rough paper sheet, and then pack it in a polythene, put it in a closed dustbin wherever the municipal corporation comes and they used to collect all the this one. There you have to dispose. Rather than throwing it in a trash in an open area, it will create serious problem, bacterial, fungal, so many problems. So throwing the menstrual napkins and pads in an open area is not a good way of disposing it. You have to just wrap it and then you have to put it in a closed dustbin. This is the only best way of disposing the sanitary napkins. And as you said, biodegradable, there are I said menstrual cup ke alawa we don't have any other option. So we just hand over to the
municipal
corporation. They used to do. Waste of our hospitals are also getting disposed by the bio waste. They used to come every day. They take the vehicle and come, and because we have a placenta and injections, so we keep on according to that like dustbins colored are there, yellow, blue, green, wet, dry, and all such. So we follow all the norms and we just dispose according to that. If anyone don't have a municipal corporation where they dispose it, they can put it in a hospital also, dustbins, because they used to follow the instruction properly. So this is also one best way. If any of the person has like we don't have coming municipal corporation do not come in our society, how to dispose? So I tell you that dispose in a dustbin of a hospitals, but according to the color and with the permission of the hospital owner, because our dustbins and our trashes are taken by a bio waste person.
It's all fine when you give it to the municipal corporation. Like, what do they do after they take it? If they're just going to dump it in the landfill, then that really doesn't solve any issue. That creates a bigger issue.
Yeah, this is the issue. It might be they just do some throw it in a wet garbage and all, and they just dispose accordingly. But I don't have any idea that what they do for the menstrual is how to dispose. This is the real issue nowadays in our society.
Yes, yes. Well, thank you so much for your very thoughtful answers, Dr. Khushbu. May God bless you.
Thank you so much.